Before entering my patient's room, I'm going to review the physician's orders and make sure that I have the correct stuff for the correct procedure. So I'm then going to enter my patient's room. Hello, my name is Gregory Hedrick. I'm going to be your student nurse today. We are going to be inserting an NG tube, alright? This process can be kind of uncomfortable and it's painful. So I'm just telling you that in advance so that it's not surprising to you that this is not a very fun procedure for me to do or for a patient to receive. But we're going to put you in the high Fowler's position. Can I get your name and date of birth, please? John Doe, 89. Okay, sounds good. We're going to relieve some of that stomach pressure though so you can feel better, alright? Alright, so we're going to start the procedure by assessing for your bowel sounds. So I'm going to go ahead and do that right quick. I'll assess each quadrant for a full minute. And noting the activity in each quadrant. I'm now going to measure the length of my NG tube. And then down to the xiphoid process. And there's my length, so I'm going to apply tape to my length. To mark the measurement. Okay, and then before inserting the NG tube, I'm going to inquire as to if there is any obstructions blocking the patency of his nares. But both nares are patent and open, so I'm going to select the right nares and don clean gloves, and I'm going to lubricate the first 3 to 4 inches of my NG tube. I'm going to have my assistive nurse come in and help me by providing water for my patient as the NG tube goes down. So I'm going to go ahead and lubricate the first 3 to 4 inches of my NG tube. Alrighty. So I'm going to instruct the patient that I would repeat the instructions, telling him what I'm going to need him to do. I'm going to need him to hyper extend his neck as I go in, and then if he starts gagging, I'm going to pull back to relieve that symptom, and then before inserting again, I'm going to have him drink the water, and as he's drinking the water, I will continue inserting the NG tube. So we're going to go ahead and start the procedure. I'm going to insert into his right nares. And now the patient is starting to gag, so I'm going to pull back 1/8 of an inch. I'm going to tilt his head forward and tell him to drink, 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 drink. And I'm going to quickly and gently insert the tube. Alright, and then have him relax. Now I'm going to secure and mark the NG tube. So I'm going to go ahead and take my tape and mark the NG tube. I'm going to secure it to the nose. I'm going to rip the tape in half. Making my pants. Looks like little pants. Alright, secure that to the nose. And then one around this way. Alright, now I'm going to mark the length of the tube, and then I would measure it, what's outside, so if he pulls out the tube that we can know to insert it to the proper spot. Now I'm going to secure the tube to the patient's gown using tape and a safety pin. So I'm going to take the safety pin through the tape and connect it to the gown. So that they do not pull out the nasogastric tube. And I'm going to aspirate some of the gastric contents and assess for the pH. Assess for the pH of the gastric contents. So I'm going to withdraw 5 cc's of unclamp and draw out 5 cc's of gastric contents. And place the plug back in. Now I'm going to assess the pH of the contents into the container, test the pH. pH is normal, so I will then discard the gastric contents into a biohazard container. I will then ensure the patient is comfortable, make sure he's not coughing, assess for any symptoms that the tube might be in his lungs instead of the stomach where it should be. And then I'm going to lower the bed to proper work height. I would follow my ending implementation steps with my patient and make sure that he's comfortable and provide him with a call light and provide that he is comfortable. Alrighty. And I would tell him I will be back to check on him as soon as the x-rays come back, because before inserting any fluids into the NG tube, we have to have an x-ray to ensure the location. So I will send or notify the radiology department that we need an x-ray to ensure the location. So then I would then don my gloves, wash my hands, and leave the room. And I make sure he has a call light. Now we just got a new order saying that we need to remove the nasogastric tube. So then I'm going to review my physician's orders and go back into the room and remove the nasogastric tube. So I'm going to knock on the door. Hello, my name is Gregory Hedrick. I'm your student nurse today. We are going to be removing your nasogastric tube. Can I get your name and date of birth, please? John Doe, 86. All right. I'm going to go ahead and raise the bed up. We're going to be removing the nasogastric tube, so I'm going to have to put you into an upright position. We're going to go ahead and don clean exam gloves. And provide the patient with tissues in case he tears up from removing the nasogastric tube. I'm going to take a alcohol prep pad and use that to remove the tape around the nose to prevent any irritation to the skin. So I'll then go ahead and remove the tape from the patient and continue the safety clip and the gown, and then apply my wet pad and emesis basin in case he needs to vomit. So I'm going to inform the patient to hold his breath, and then while he is holding his breath, I'm going to quickly remove the nasal gastric tube, and I will cover it in a cloth or rag, and to keep it out of the patient's sight, and then dispose of it. So I'm just going to set it down because I do not have a biohazard container. I'm now going to provide the patient with a warm, wet cloth to clean their face from any gastric contents, and provide oral care as needed, or give them washcloth or mouthwash to clean out the taste of stomach acid, because it will taste the same as vomit. And then I will give him a glass of cool water to soothe his throat. I'll remove the emesis basin, assess him for any nausea or feelings of like sickness, make sure that he's in good shape before I leave the room. And then I will reassess his bowel sounds to make sure that the nasal gastric tube was effective. So I'll listen to each quadrant for a full minute. And all quadrants appear to have normal activity. So I'm going to lower the patient's bed to safe height. I will then document my procedure, including the pH of the stomach contents, and then I will also document any aspirate for consistency, amount, or color, and I will document my findings. I will assess the patient to make sure that he is feeling well before I leave. Make sure the bed's at its lowest height. Make sure my patient has a call light. I'll tell him I'll be back in a couple hours to check on him, and if he needs anything, to not hesitate to call us.